Guys, for the past 2 days, my inbox has been ablaze with messages. Popo, is it true that the UK is going to stop recruiting nurses from overseas? Is it true that the NMC has made some changes and they no longer want to recruit nurses from overseas? People are panicking because we have seen or watched videos which have actually indicated that the UK is going to stop recruiting nurses from overseas, and we're panicking. I haven't done this. Am I going to get enough time to be able to come to UK before they stop recruiting from overseas? And I did find out that people are actually posting that the UK is going to stop recruiting nurses from overseas, and this is what I'm going to be talking about in today's video. And if you are a returning subscriber, you know that in this channel we don't sugarcoat anything, we keep things real. And I'm going to be talking about the reality on the ground here in UK with regards to the recruitment of nurses from overseas. And if you're new to my channel, my name is Pauline Popomoyo, and like I've already said, this is the channel where we keep things real. And if you're interested in relocating to overseas or hearing nothing but the truth, you smash the subscribe button. It's free. Turn on the notification bell so that you never miss any of my videos, and give this video a thumbs up. And without wasting any of your time, let's get into it.
I heard they asking for the queen. I'm a bad bitch, she's a savage. Look back while I twerk. No comparison. I'm a savage. Yeah. Classy, bougie, ratchet. Yeah. Sassy, moody, nasty. Yeah. Acting stupid. What's happening? What's happening? I'm a savage.
Is it true that the NMC is implementing some changes into nursing here in UK? The answer is yes. It is very true that on the 25th of January 2023, the NMC said they are coming up with some changes to pre-registration for nurses as well as for nurse training here in UK. And I'm going to be sharing with you why they are proposing those changes, and I'm also going to be discussing with you whether they are stopping international recruitment of nurses. As we all know that Brexit happened a couple of years ago, which means the United Kingdom moved out of the European Union. And the NMC has actually said that it is no longer necessary for them to continue following the rules and regulations or to follow standards set by the European Union. They now want to set their own standards, which are actually going to benefit people who are here in the United Kingdom. So this is what they have proposed. Now we have left the EU, we no longer required to include some European regulations in our standards. We are taking the opportunity to make changes that will enable a broader range of students to join our register with the knowledge and skills to provide safe, effective, and kind care for people. So they want to make changes so that they are able to include more people into the NMC register. As you all know, the United Kingdom is experiencing a critical shortage of nurses, and they are saying to curb that problem, they want to basically relax some of the rules and regulations to enable more people to come into the register. So for nursing only, they are increasing flexibility around the use of simulated learning. So what they are proposing is that out of the 2,300 hours that are needed in practice, 600 of them are going to be simulated. So what do I mean by simulated learning? This is something which they've not been doing in UK, but we have been doing it in our countries. I was a tutor where I come from, and we used simulated learning, and we used to call the room where we did the simulated learning demonstration room. And in the demonstration room, so I'm sure some of you who were trained by me remember the Mr. Jones that we used to have in the demonstration room, whereby we were saying the Mr. Jones is for example, a dummy. We are going to be talking to Mr. Jones as if Mr. Jones is a patient. We are going to be giving drugs to Mr. Jones. We are going to be bathing him, doing dressings, catheterizing him, and all those nursing procedures are going to be done in a simulated environment. This is a room where they're going to be actually mimicking a ward setup, of which they've not been doing that in the United Kingdom, but we have been doing that from time immemorial overseas. We have been doing simulated learning for a long time overseas. So this is something new that they want to introduce, to say 600 of the hours, instead of students going to the clinical area, spending 2,300 hours in the clinical area, which is required, they're going to scrape out at least 600 hours so that they use those 600 hours for simulated learning. So why are they proposing this change? Is because if you look at the article posted in November, one of the reasons that they are not able to take in as much students as they want is because of lack of clinical places. It's because of lack of space. 1, classroom space. 2, space for clinical placement. They're not able to place them in different hospitals because there is no space for them. So this is what the article posted on 6 November actually says. Why are nursing programs so hard to get into? The main reason many programs are not easy to get into is because they lack the capacity to teach the number of applicants they receive. There is shortage of nurses with master's degrees or doctorates that are willing to teach. There is also shortage of clinical sites and classroom space. So guys, as you can see, the last thing that they stated is that there is shortage of clinical sites and classroom space. The number one problem that they have is that they lack the capacity to teach the students that they actually receive. Why? Because they do not have qualified staff. There is shortage of qualified staff to actually teach these students. Has that problem been solved? No. That problem has not been solved. Only the problem of clinical space and classroom space is the one which they've tried to solve. So does this mean that they're going to stop recruiting from overseas? One, how are they going to hire more student nurses if they don't have people to teach the student nurses? There is no way you can enroll more and more and more people when there's a critical shortage of staff, when there's no one who's going to teach the students. Okay, that's the number one thing. 2, before I move into their next proposal, let us just look at the shortage of nurses here in the United Kingdom. When I came to UK 5 years ago, there was a critical shortage of nurses, and England was standing at around 32,000. They needed 32,000 nurses 5 years ago. Fast forward to 2023, because that was in 2018. Now fast forward to 2023, England, and I'm talking of England alone, I haven't included Scotland, Northern Ireland and Wales. England has got a shortage of 50,000 nurses as of end of 2022. 50,000 nurses. So how are they going to stop recruiting nurses from overseas? Because some of these things we have to think realistically. You cannot say just because NMC has said they're going to be making the enrollment more flexible, then it means that they're not going to be hiring from overseas. Hello? There is a critical shortage of nurses here in UK, and this is what the NHS is actually saying about recruiting nurses from overseas. The NHS states that the NHS has always benefited from overseas recruitment and from nurses coming from other countries to live and work in England. Recruitment from outside of the UK continues to feature as an important part of the workforce supply strategy for NHS organizations in line with the NHS People Plan. Let me repeat that statement. Recruitment from outside the UK continues to be an important part. Which means it is a vital part, which means it is necessary for the United Kingdom to continue hiring nurses from overseas. And hey, the United Kingdom started hiring nurses from overseas since the 1930s. 1930s. How old were you in 1930? How old were you in 1930? The UK has been hiring nurses from overseas since 1930. And these few changes proposed by the NMC don't necessarily mean that the UK is going to stop recruiting from overseas. The UK is going to continue massively recruiting from overseas because they've got a critical shortage. And why would you even announce that the UK is going to stop recruiting from overseas? How long is nurse training if you want people to start panicking to say, oh, this is going to close before I finish? Nurse training is 4 years in UK. So what is going to be happening in the next 4 years? So the statement which rubbed me very wrong is the statement which says the UK would rather recruit people who are trained here in UK because it is very difficult to train here in UK. I can imagine if you have trained outside UK and if you are recruiting from outside UK, you have to train the nurses, the nurses who are trained outside the United Kingdom are brilliant. What training do they go through here in UK? Because objective structured clinical examination is easy peasy lemon squeezy. We cannot really talk about things like being trained on and administering medication. When we talk of nursing outside the United Kingdom, we are mini doctors outside the United Kingdom. We are mini doctors because we can run a clinic on our own. I, as a nurse, if I'm in my country, I can run a clinic on my own. I can prescribe medication for patients. I can decide this patient needs a drip, commence them on IV fluids, choose which IV fluid to use on them. If they're going to cardiac arrest, I decide, okay, let us give adrenaline, let us give what? Because we are that much educated. I've worked with nurses from Nigeria. I've worked with nurses from Ghana. They are brilliant. I've worked with nurses from all over the world. They are really brilliant. So let us not look down upon nurses who are coming from overseas because they are the backbone of the NHS. Backbone of the NHS. If you go to any hospital, whether in Wales, whether in Scotland, whether in England, all the hospitals have got nurses from overseas, and they are still recruiting more and more and more nurses from overseas. If you are to choose between a nurse with 10 years experience from overseas as opposed to someone who has just completed their training here in the United Kingdom, realistically speaking, who are you going to choose? Just because you have finished your nurse training here in UK, it does not mean that you've got vast knowledge as opposed to me, who has got 15 years of experience dealing with patients. Because when it comes to nursing, a heart does not change because you're now in the United Kingdom. Arteries do not change because you're now in the United Kingdom. No, such things don't change. Anatomy and physiology remains anatomy and physiology, regardless of whether you're in Africa or you are in UK. There's nothing like, oh, I've seen a UK heart, or I've seen a UK eye, or I've seen a UK finger. No, a finger is a finger, an eye is an eye, regardless of where you are. So there isn't much of a difference. There isn't much of a difference whether you trained in the UK or you trained outside UK. But the difference is that those who trained outside the United Kingdom, the training is more complex because you don't have things like, I'm going to do mental health nursing alone. You do basic nursing first, then you do mental health nursing, which means you can never do mental health nursing without starting by doing the basic nurse training, which is 3 or 4 years. So which means at the end of the day, you cannot compare someone who has had just mental health training and someone who has had nursing training as well as mental health training combined. Anyway, now I am talking too much, guys. Let me move on to other proposals. But what I want you to know is that this thing that the United Kingdom is going to stop recruiting from overseas is a false alarm. False alarm, so do not panic. Let us just move on to other proposals. So the NMC, they also state that we are giving education institutions more flexibility to set their own robust entry requirements, including removing the need for at least 12 years general education before starting a nursing or midwifery program. Our discussions with stakeholders found the concept of general education is arbitrary, open to interpretation, and can mean different things in different locations. Removing this will make a career in nursing or midwifery a reality for more people, such as refugees and those from traveling communities. We are removing EU stipulations about the settings in which nursing and midwifery practice placements must take place. This will allow students to do all their practice learning in the settings most relevant to them. We are proposing a new midwifery standard to ensure students gain experience with a range of maternity providers and teams. So what they are basically saying is that each institution is going to come up with their own requirements for nursing. Each institution can say, for example, you should have O-level for you to do nursing, or you should have A-level, or you should have less than O-level for you to be able to do nursing in their university, of which I don't see any university, this is just my opinion, saying, oh, you've had your 10 years education, which means you did not even pass your O-levels, because for you to be able to pass your O-levels, you should have done at least 12 years of education, then you pass your O-levels, your biology, your sciences and whatever, then you go and do nursing. So if they're saying less than 12 years, they're going to be taking people who haven't done O-level to do a nurse training. Because as far as I'm concerned, nurse training is something which is complex. You're going to be dealing with people's lives, and you need to know what you're doing. You need to know your sciences. You need to know your sciences because you're going to be talking about the human body and how it functions and everything. And just because this proposal has been put in place, it doesn't necessarily mean we're going to have thousands and thousands and thousands of people going for training. And the training is still 4 years. So we are talking of 4 years from now. So where are we getting this thing that they'll stop recruiting from overseas? So where are we getting this thing that the UK is going to stop recruiting from overseas? Why are we just causing people to panic? Because there is no reason to panic, because as we speak today, England has got 50,000 nurses being needed. They've got 50,000 vacancies for nurses. And do you know where they're getting those nurses to fill in those vacancies? From overseas. So if you are overseas and you want to come and work in the UK, go ahead, do your IELTS, do your CBT, and vacancies are actually waiting for you. Vacancies are actually waiting to come and be filled by you. So there's no need for you to panic, because the UK needs you. You are an essential asset. You need to come to UK because the UK needs you. There is shortage everywhere, critical shortage everywhere. I've only referred to England. There is shortage in Scotland, there is shortage in Wales, there is shortage in Northern Ireland. They need nurses in the United Kingdom, and the UK is not going to stop recruiting from overseas, and the UK has been recruiting from overseas since the 1930s, and it is going to continue recruiting from overseas. And now they're going to be recruiting more than ever from overseas because of the critical shortage, guys. So these are the proposed changes that I wanted to share with you guys. At the same time, I wanted to debunk this thing that the UK is going to stop recruiting nurses from overseas because of the minor changes which the NMC has made. These are minor changes. Major things like critical shortage, you still don't have qualified people to teach these nurses. And if they don't have qualified people to teach the nurses, they are not going to recruit. They are not going to bite more than they can chew. They can only bite what they can chew. Thank you so much for watching, guys. Don't forget to smash that like button and share this video with your friends. Share it with your friends, because I know a lot of people are worried about this, or the UK has not stopped recruiting from overseas. And turn on the notification bell so that you never miss any of my videos. Thank you so much for watching, guys. I will see you in my next video. Bye.